What is the primary reason for following guidelines in distributing laboratory results to providers after matching the patient to the correct provider? So you might read this and think, what's this asking? So the overall idea of this question is, why is it important, the primary reason, to get the lab results, so lab results for the patient to the provider. And the overall idea is ensuring that you have the correct patient information. Now, you might notice from doing these questions that really the overall theme for every question for the medical assistant exam is safety. Really safety, and then secondary maybe is the patient experience. But really number one is keeping our patients safe, and that includes ensuring they have the correct results, because if they don't have the correct results, we can miss a diagnosis, we could treat for something that's not the right diagnosis, and we need to ensure that all the results are handled with care and safely so we can get our patients treated the best we can. So let's keep safety in mind as we look at the answer choices for this question. So option A says to ensure timely billing for lab services. And remember, when we see our primary reason, it's the main reason. So maybe this is a secondary reason, but overall we want to look at the primary reason. And the primary reason has to do with safety. That always should be what you should come back to on any question that has to do with the medical examination. You want to make sure that what you're picking has something to do with patient safety in most cases. So we could eliminate option A. Option B says to minimize the risk of incorrect diagnosis based on mismatched results. And overall, that's what we're looking for, right? We have our lab results. We need to get it to the provider so we can get the right diagnosis, so we can get the right treatment, so we can keep the patient safe and healthy. So option B is looking like a good choice. Let's take a look at option C. To prioritize urgent results for critically ill patients. And although that is important, we need to make sure that we get critical results to the provider in a timely fashion. This question is focusing on following guidelines and just distributing laboratory results in general. And we also need to keep in mind a risk of mismatching results. And if we do mismatch results, like they're saying in option B, then these critical results could go to the wrong patient, and then our critical patients wouldn't be treated anyway. So really the main primary reason is just getting the right diagnosis to the right patient just overall. We want to prioritize critical ill patients, but that's not what the focus is on for this question. So we can eliminate option C. And then option D says to maintain patient confidentiality and prevent unauthorized access. That's important, but that's not what the overall reason is here for distributing laboratory results to the providers. So we could eliminate option D. And that leaves us with option B, minimizing risk of incorrect diagnosis based on mismatched results.